Okay, this is the Health and Welfare Committee meeting, and we are back looking at H 464 bill related to miscellaneous changes for the Reach Up program. Thank you all for being here. We did go through a proposed amendment with our Ledge Council just prior. We had a little time, so we went through it earlier. And we look forward to your testimony now to help us improve the bill. So Amy Rose is here. Thank you, Amy. Why don't you go right ahead, introduce yourself for the record, and then we'll listen to your testimony.
Thank you. For the record, I'm Amy Rose with Voices for Vermont's Children, and Michelle Fay is here, our executive director, who is going to do the bulk of the testimony today.
Perfect. Thank you.
Good morning, Michelle Fay.
Michelle.
Hi.
Have you been in our committee yet this year? I don't think so. Have you?
I don't think so. No, I've lurked outside your door, but I haven't been in.
No, we have limited access this year, which is too bad.
I know. I thought about coming in person today, but I thought this is just as good, and you can see each other's faces, or see my face this way anyway. So, so thanks for having me, Michelle Fay with Voices for Vermont's Children. A couple things before I dig into my testimony. I did want to note that I sent 2 documents over to Aaron, and one of them is just a one-pager that you probably also received a paper copy of recently. And the testimony today,
Michelle, I'm going to ask you because the sound is wonky when we're on YouTube or Zoom, if you could just have a slightly slower pace of delivery, that would be great.
Thank you. I appreciate the reminder. I always need to be reminded. So there's a one-pager that was circulated earlier this week that is kind of a synopsis of some of our requests, but as our thinking continues to evolve, there's some slight differences in what I'm saying today. So if there's any confusion, please feel free to ask me about it. And on the back of that one pager, there is a first-person account from a mom who is a Reach Up participant, just giving a little insight into what her life is like. And I also want to note that I didn't catch the amendment and you going through it, so I'm not sure what that's about, and I'm not going to be speaking to it, so I apologize for that.
Okay.
So in order to provide some context for our testimony on H464, I'd like to start with a brief introduction of our work around Reach Up more generally and the path that H464 took to get here. Then I'll highlight the promising policy changes that Voices enthusiastically supports and share our proposals to correct omissions in the bill that we think will undermine Reach Up's effectiveness in improving the lives of children. So social welfare programs like Reach Up are burdened with stigma and rooted in prejudice, primarily against Black women and people who struggle to make ends meet. Participants are generally too busy trying to survive to get involved in advocacy efforts. And it's important to remember that the majority of Reach Up participants are children. That's why we're here. Voices and our partners, particularly Vermont Legal Aid, along with Public Assets Institute, the Vermont Low Income Advocacy Council, Hunger Free Vermont, the Parent Child Center Network, and others, step into this advocacy space on their behalf. We strive to share both participants' lived experiences and the robust body of research around how to repair the harm caused by previous policy decisions we've made as a state and as a nation. Allowing poverty to persist in Vermont is a policy choice. Several states are actively working to eliminate child poverty, and we'd like Vermont to join them. To that end, we were delighted to find champions in the House to help advance a bold vision for Reach Up in what started as House Bill 672. This bill was evidence-driven and truly centered around meeting the needs of children. Several aspects of that bill evolved and merged with H464, but arguably the most important components, which address the insufficiency of the income support grants for families, did not survive the merge. And as a reminder, a primary mandate of the program is to improve the well-being of children by providing for their immediate basic needs, including food, clothing, and shelter. So for a minute, I'll pivot to a more positive note and express what we were excited to see in H464. So we support the increased earned income disregard and the child support pass-through. We see these as supplemental measures that will help families as they transition off the program and as they're overcoming barriers to employment. But it is important to note that only 11% of adults in ReachUp work for wages. So the additional income will make a difference in a very limited number of families. We don't have the data on the number of ReachUp families with an active child support order, but as we know, there's always cases that have a waiver due to intimate partner violence or potentially other causes. So the only way to ensure that every family has sufficient resources is by adjusting the benefit levels. And I'll come back to that in a minute. Voices supports and appreciates the programmatic shift proposed by the department that's in the bill. Economic Services has been engaged in a major shift following research on the best approaches to supporting family economic security and moving to a strengths-based family stabilization practice. We've heard from recent participants that they appreciate it when ReachUp case managers honor their experience and engage with them in ways that build trust and allow for vulnerability. Case managers have the power to make decisions that will impact families significantly. So the goal-oriented approach proposed in H464 lends itself to a supportive partnership between case managers and participants, and the expanded list of employment readiness activities that fulfill participation requirements are a much better match for the barriers faced by families than an inflexible work requirement. We do want to mention a need for transparency and accountability in the program. Culture change within systems is difficult, and we know that amending statute is only one step in the change process. Voices and our partners have in the past suggested to DCF that the goals of the program would be served by the creation of an advisory group of stakeholders, including current or former participants, advocates, and community direct service providers, with whom Economic Services could consult as they develop rules, legislative proposals, and the 5-year federal TANF plan. We hear stories that indicate inconsistencies in practice can mean kids and caregivers may have different supports available depending on the case manager they speak with. An advisory committee could troubleshoot these issues, review quarterly reports to monitor trends and utilization, and advise on any discretionary budget adjustments. We recommend that H464 be amended to create such an advisory committee, which could be modeled on the one that was formed for the SNAP program. And I also want to take this opportunity to note that the Advisory Council on Child Poverty and Strengthening Families, which was meant to be one of the places where there is an interdisciplinary lens on family and child poverty, has not convened at all during this legislative session, and in fact hasn't had members appointed by either the House or the Senate. It's time to take decisive action to end child poverty. As mentioned above, the other original ReachUp bill sought to achieve comprehensive modernization of the program, including setting a benefit level that meets the program's stated purpose to provide for children's basic needs. The vision in H672 was ambitious and inspiring. Today, I'm proposing a compromise that would establish a basic safety net for children, youth, and families who find themselves in extreme financial distress, and align the financial support that we're offering with the program modernization measures that are already included in H464. So currently, the benefit level is based on a subsistence budget established by DCF. And even though DCF goes through the practice of updating this annually to reflect changes in cost of living, to my knowledge, none of the past 3 administrations has ever factored this into their budget proposals. The only adjustment to the ReachUp benefits have been initiated by the legislature, and more specifically, often, if not always, by the Senate, including last year's increase, which brought grants up to half of a subsistence budget from 2019. In the past year, with skyrocketing inflation, the value of those grants has dropped substantially, but there's no proposal to correct this in the FY23 budget. We've heard several defenses of this, including references to the temporary federal program increases and one-time payments that were made using pandemic relief funds. But obviously, these are not ongoing systemic solutions. DCF sometimes circulates a table that tallies the value of all the public programs, with the implication being that the total lifts people above poverty. but you can't buy diapers with Dr. Dinosaur or fill your gas tank with the childcare subsidy. If you read the small print at the bottom of that table, DCF even acknowledges that benefits are inadequate to secure sustainable, safe housing. When you sift through all that noise and focus on the basic needs of kids and families, you will find that our income support programs keep people in poverty by design. The following chart was generated by our colleagues at Public Assets Institute to illustrate the gaps between the need as defined by DCF, which is that blue reach up basic needs estimate line, a subsistence level. And then above that, there's the JFO basic needs line, which is a more moderate basic needs budget. And the combined value of the public benefits is the green and blue bars below. So you can see that there is still a gap, even when you add up the benefits that can actually be used to support people's basic needs, we're not getting there. So we propose that the legislature set benefits so that when you combine those basic need support programs, that you do reach that subsistence line. And we also propose that rather than revisiting the issue every year, the legislature mirror what New Hampshire has done and set the benefit levels at 60% of the federal poverty guidelines. We think, just based on a back of the envelope calculation, that combined with 3 Squares, LIHEAP, and Lifeline would more or less hit that blue line of a subsistence level income level. This really ought to be the absolute minimum that we consider acceptable for children, and it should not be up for debate every year. Taking this approach would also remove the consideration of housing from the reach up calculation and streamlined benefit calculations. There's been little appetite for updating housing allowances. There was a lot of language about that in the original 672, but it didn't get any traction. But housing allowances right now are based on an odd, non-standard measure. It's an average of what participants reported spending on housing 21 years ago in 2001. The $200 to $270 a month that Reach Up participants currently receive for housing barely makes a scratch in a fair market rent for a 2-bedroom apartment, which ranges from a little under $800 a month in Essex County to about $1,500 in Chittenden County. So by shifting to the federal poverty guidelines as the basis for our benefit levels, DCF will no longer need to engage in a parallel process for determining need. Again, our back of the envelope estimate for the cost of this, just based on the unfunded budget pressures report that the administration puts out, looks to be about $5 million, which is coincidentally right around what was cut from the Reach Up budget in the governor's recommend. So I provided some proposed statutory language below. The highlighted part is more or less pulled directly from New Hampshire. And I thank you for the opportunity to speak with you on behalf of the thousands of children and youth who depend upon Reach Up. And I look forward to the day when we can focus our conversations on how to help kids thrive, not just survive. Happy to take any questions.
Okay, thank you. And so the suggestion that you're making in the eligibility and benefits levels, maybe you could just talk briefly about what we're looking at here. So you're saying this is more consistent with what New Hampshire does?
Yes. Yeah, back in 2017, I think it was, New Hampshire, which had been a fairly low TANF grant for families, just kind of settled the issue once and for all by setting it to be indexed to the federal poverty guidelines. And so their TANF benefits are 60% adjusted automatically. And I think in the one pager we sent, we were proposing that that we lift the rateable to 60%. It's about the same because and Aaron or Katarina could correct me, but the basic needs standard is technically different than the poverty guideline, but it's dollar-wise, it's about the same. It comes out pretty close. And so it just seems like it would be simpler to index to FPGs.
Okay. Other questions, committee, for Michelle, clarification, information.
So,
Yeah, Senator Hooker.
thank you. So Michelle, the 5 million that you quoted, if we were to implement this, going with the federal poverty guidelines, that's the cost
I
Or-
would definitely recommend seeking a fiscal note, but just looking at, if you look at the unfunded budget pressures report, it shows that we're spending 24 million on Reach Up grants to families, and that to fully fund that program would be, I think, 48.3 million. So if you consider 24, 50%, and then kind of do the math around to see what 60% would be, that we came up with about 29 million. So it's imperfect for sure, but that's just a rough guess.
Okay, thank you. Questions? All right, thank you very much, Michelle. We really appreciate the time and the information, very helpful.
Thank you.
So we're going to move on to, and now Aaron, are Aaron and Katerina, are you testifying together at our, yes? So do you have it coordinated? Why don't I turn it over to you and let you go ahead.
Thank you, Chair. Thank you for having me here today. I'm Katerina Lasias, the Senior Advisor to the Commissioner at DCF, and with me I have Erin Olekin, the Director of our Reach Up program. I just want to take note today that Erin has been working with the Reach Up program for 19 years, and we're incredibly happy and honored to have her in the program. So I'm not sure exactly what would be helpful, but I'm happy to talk through how we worked with the House Human Services Committee on H464, just to give the committee some background. Would that be helpful, Chair?
Yes, please, that would be very helpful.
Okay. So what we worked on earlier in this year was the original introduced version of this bill, which was to expand the post-secondary education program to impact both parents in a two-parent household and eliminate the medical review team. These were supported by the governor and introduced as the original H464. And then there was a separate bill, as Michelle mentioned in her testimony, that was a much larger overhaul of the Reach Up program. So DCF worked with House Human Services to see if there was, more that we could work on within the Reach Up program. And this is where I would highlight the great work that Erin has done in the program. So we took a look at the state statute and was seeing how it could be better aligned with how the program serves Vermonters. So Erin has been training her staff for the past number of years on a goal-oriented approach, which is why when you look at the text of the bill, there's a lot of strike-throughs. So when we began to consider how this would better serve Vermonters, we thought about how can the statute reflect the work that Erin is doing in the field. So that's where we came up with the idea of the participant requirements, or that universal engagement model, rather than having the work requirements and the deferments, which yes, are part of our federal requirements and reporting, but as we wanted the Vermont statute to reflect what we're doing here in Vermont, and we can do the federal reporting sort of on the back end. So that's where we came to with those. So we are supportive of sections 4, 5, 6, 7, 8, and 9. Sections 1, 2, 3 are not part of the governor's proposed budget. Those are the earned income disregard, the child support pass-through, and the raising of the age. The department just doesn't know how that's going to overall impact the program and the department's budget at large, but we do recognize that they are good policy.
Okay, thank you for those comments. They are helpful. Appreciate it. So, Erin, did you want to continue? I'm leaving it up to you too to give us the full scope.
Good morning. For the record, I'm Erin Olekin. I'm the director of the Reach Up program. I think Katerina really covered a good overview of where we are with the bill right now. I'm happy to answer any questions or reflect upon any of the previous testimony if that would be helpful to you. So I'm here to answer any questions that you might have about any of the program history or how that fits in, or the direction that we're going right now.
So, I guess the question I would have, I'm gonna go right to the sections that you're not supporting, knowing that there are sections you are supporting. So 1 through 3, those are not in the governor's budget. Have you done any cost analysis on those? Can you share some of your thoughts or what you have found, given the new age that's included, and then how the other sections, how that might affect budgetary?
Absolutely. So we walked through all of the parts that would cost money, and we did work with Nolan Langwheel on a fiscal note. So for the first section 1, the increasing the age of the dependent, we using current Reach Up data on children who may be in that category. We think this year would cost around $43,000, but it could increase because we're only basing that on this year's data.
At $43,000 in total?
Per year, it might fluctuate per year, but
yeah. Okay.
For the earned income disregard, again, we base that on, sorry, I'm looking at it and talking at the same time. I think that's about a $212,000 increase to the Reach Up program. And then the child care or the child support pass-through is $187,000.
And this, okay, then the next question is, this is all ongoing operational expenses that we would be seeing over time. If we apply the 60% of FPL that's being recommended by Voices for Vermont's Children, did you look at any of that?
No, this is the first time I'm hearing of that proposal, okay. So we haven't looked into that. I would just say that we did this analysis looking at each component independently. How they will interact with one another is part of the reason why we just have, we need to consider how that would impact the program, because if someone is receiving the earned income disregard, it may impact their SNAP benefits or their other benefits. It might impact overall caseload in the Reach Up program, and those are the parts where it's a bit harder to analyze.
Okay, thank you. Committee. Well, good news. Erin has just posted the fiscal note that we can look at for the bill.
I was just searching for too. Thank you.
So if you refresh, you'll be able to pick that up.
I found it a long way.
The last component of the fiscal analysis is our IT systems upgrade, which is a $500,000 estimate. And that's because of the timeline of getting the IT systems upgraded. It's not only the Reach Up program that needs to be upgraded, it's our child support system, it's how it interacts with the other complex systems in the economic services division. And it will likely have to happen as a contract to be able to happen in this timeline.
So this was a question that we had in our committee regarding the amount of money needed to do this. And I know that this will link in with an integrated eligibility system. So is this part of that process that we've been talking about in the past, or is this a new piece?
This would be associated with just this bill, so it would be a new piece. Of course, we want to keep things as aligned as possible, but we would be working on a separate timeline.
Okay, all right, but it will be integrated with the integrated system.
Yes.
Okay. Questions, Senator Hardy?
Madam Chair, so one of the amendment that we were just discussing was about the elimination of the medical review team. And there was this timing issue and that came out and then went back in. But my understanding is you are all okay with eliminating that. And so our amendment makes it happen so we can save that $130,000 immediately. And is that, yeah, you're good with that, or?
Well, there's
I'll have to have our team look at the amendment, but in concept, we're supportive of that. The language we sent earlier this morning was to essentially accomplish the same thing. So if we're looking at that from different lenses, we'll just have our team look at it and get back to you.
Okay, the amendment is on our website. We went over it this morning, so it seemed like low-hanging fruit if you were already preparing to do that, and we just needed to draft it differently.
Okay, is that the
draft amendment that's on our webpage.
okay, thank you.
Yeah.
All right. Okay, go ahead, and then Senator Giannini has a question.
I guess I'm interested in I know you're just hearing this testimony from Voices, but and the $5 million is a big amount compared to the rest of the fiscal note. But do you have any response to their testimony? Do you agree in concept? I know you can't, it's not in the governor's recommend, and I know what you have to say about all that. So, but just sort of in general, besides that, like, what are your thoughts on that shift?
I think that we would have to better understand exactly what is being asked. We can look at that and follow up with the committee if that would be helpful.
It would, we're getting to an end here, and this is a new request. I'm not sure that we can accommodate a new request.
Well, the budget is being finalized.
Yeah, the budget,
So
yeah.
it's not in there.
It will be if it's something that happens, it will be happening down the hallway, so.
And I know trying to get more money to reach our families has been a goal of
Yeah.
the chair of appropriations.
Yes,
So
very much so. Senator Terenzini, you have a question.
Yeah, question, comment. Thank you, Senator Lyons. I've been somewhat critical in this committee over the last few days. We've discussed this $500,000 for the IT upgrades, and I can't seem to wrap my head around the sheer fact that we're looking to spend $500,000 on these improvements. Can you elaborate a little bit more as to what it truly is going to go for, and is it a system-wide? Is the money going to be used for more than just this, to upgrade systems across the entire agency, or just elaborate if you would, please?
Yeah, so the current systems, I don't think it's any surprise to the committee, the current IT systems we use are pretty archaic. And to update the systems, while these seem like simple changes, actually interact with 3 or 4 pretty complex systems. And to make those changes, we've estimated it will be around 2,500 hours across 3 or 4 different systems. And we need to keep those up and running, simultaneously, so that Vermonters aren't harmed by any of the changes in the meantime. And again, because of the timeline of the legislation, we would likely have to do that out of house in a contract.
So that's exactly what Nolan told us from JFO the other day, almost word for word, actually. You guys are like in lockstep. And I want to make it very clear, I'm very supportive of the Reach Up program. I'm very supportive of getting as much more money to these folks that need it. It absolutely breaks my heart to think about what families are having to struggle with. It's such little money, especially with inflation and gas prices and everything else we're dealing with. I just, I'm going to support it, but to say $500,000, I'd rather see more of that money go to helping families versus IT upgrades.
Understood.
Other questions, committee? Wow. Okay, well, we really appreciate the time that you all have taken in coming in. We don't have other questions at this point, and we will be going through the bill very soon. The money decisions are down the hall, and as Senator Cummings has said, the improvement to reach up continues to be a priority for a number of us, including members of the Appropriations Committee. So we'll do what we can, and I just want to say thank you to each one of you for the work that you've done on this bill. You know, before the session started, I met with Representative Pugh, and we talked about who was going to take the lead on Reach Up, because the agency had some important recommendations, and the work that you've done together with House Human Services has been terrific, and Voices has been very helpful. We can't, you know, we don't work alone. So thank you all for the work that you've done on this. So we're going to close on H464, and we're going to go offline very briefly, and then we'll be coming back to talk about H265. We have some proposed, some language that we'll be looking at, as well as some of the other bills that our Ledge Council is putting together for us. So thank you all. Appreciate your time. Yeah, thank you.